Hi, I'm Dr. Madhav, nephrologist at Manipal Hospital Whitefield. Today, we're talking about secondary hypertension. Many patients ask me, Doctor, I'm taking many medications, I'm eating right, but my blood pressure just won't come down. Why? Sometimes high blood pressure isn't just about age or lifestyle. For a small group of patients, it's a symptom of another condition entirely. We call this as secondary hypertension. The encouraging news is that if we address this underlying condition, then the blood pressure often improves significantly. Let us start with the kidneys. Sometimes, if the kidney functions decline or if the blood vessels to the kidney becomes narrow, then the body tries to compensate by raising the blood pressure. It is simply trying to keep the blood flowing. This is why we ask, is there a family history of kidney disease? Then we have the hormones. There are small glands above the kidney called the adrenal glands. These manage our salt levels. Occasionally, they can become a bit overactive and then they will cause the body to hold on to the salt and lose potassium. When this happens, patients may feel tired, they may develop muscle cramps, and the BP remains high despite multiple medications. So, we ask the patients, did you ever notice cramps? Did someone ever tell you that your potassium is low? This is a very useful clue for us. Sleep is also very important. Normally, your blood pressure should drop while sleeping. That is the heart's time to rest. But in conditions such as obstructive sleep apnea, where patients may have heavy snoring or pauses in between breaths, the body stays alert at night. The pressure never gets the chance to reset. So, what we ask the patients is, does your partner mention that you snore loudly? Treating these sleep issues like obstructive sleep apnea can make a big difference to blood pressures. Finally, everyday medications play a role also. Painkillers, commonly used for aches and pains, joint pains, back pains, nasal drops that may be used for cold, and certain other tablets can sometimes cause very high blood pressures without you realizing it. So we ask the patients, are you taking any painkillers regularly for your back or knee pain? And it is very helpful to mention to your doctor if you are taking any of these over-the-counter medications. So when do we look for these underlying causes or additional causes of secondary hypertension? Usually we consider it when patients are very young hypertensives, patients are having difficult to control blood pressures with even 3 medications or more, or there is a sudden change in the blood pressure, sudden increase in the blood pressure. The goal of this is not to add more pills, but it is to identify the underlying condition so that you can live healthily after. Take care. Thank you.